Hi, I'm Dr. Heather Pransberry-Stratton at HPS Advanced Dental Care. We're located in Macomb County, Michigan. I wanted to talk about a lot of questions we get from some of our parents about their children in honor of Children's National Dental Health Month, which is in February. They ask a lot, if my child has a cavity, do I have to fill it? And it's a great question because we get this question all the time. For me, I would always say yes. And, well, not always, but if they're a younger child, the answer is usually yes. And so the parents say, well, why would we want to keep a tooth that has a cavity in it and get a filling in it when they're just going to lose it anyways? Another great question. So let me answer both of these questions kind of at the same time. When a child comes in and they have a cavity in their tooth, especially if they're a younger child, we know most of the teeth, your front teeth, kids start losing around the age of 5 or 6. Give or take a little bit of time. Boys usually lose them a little bit later than girls, but usually around 5 or 6 we start losing the front teeth. Typically, we're going to see cavities in the back teeth more than we do in the front teeth. And when we see a cavity in the back tooth, it's oftentimes around that 5 or 6 year old mark. And they're not going to lose those teeth until they're probably 9, 10, 11 years old, depending on which tooth it is. So we have a choice to make. We can either take the tooth out, which is what some parents ask about. Well, should we just take the tooth out? We can do that. We can take the tooth out. In that case, though, we're going to have to do something to maintain the space. Because one of the biggest jobs of baby teeth, besides chewing and talking and smiling, is that they maintain the space for permanent teeth to come in. And so if we take out a tooth prematurely, what's going to happen is that new permanent tooth that's down below it is going to be delayed in coming into their mouth. Saying that, what's also going to happen is the teeth around it are going to start shifting. So what's going to happen around the time 9, 10, 11 is that you're now going to be forced to go into an orthodontic situation to move all those teeth back into position so that tooth can come out. If not, we get what we call an impacted tooth, which means the tooth is kind of stuck below the gum line and it can't come out because there's no place for it to come out to. So that's one of the big reasons we want to keep those baby teeth. Now, we can't make space maintainers for teeth that have such a big cavity we can't keep them. And they're little pieces of wire, basically, not quite like braces, but something a little bit similar to it, but that goes on the inside of your teeth that kind of hold that space in place. It's an option, so we can always do that if the tooth is in really bad shape. So we have different types of fillings that we can do here in the office. One of them is a typical composite filling. If you've watched some of my other videos, you probably have seen that I don't place amalgam or mercury fillings in this office, so that's not an option for us here, but we will place a composite filling. The other thing is if the cavity is really small and it's just into the enamel, maybe just barely into the dentin, we have a type of, it's not quite a filling material and it's not quite a sealant material because people ask us about sealants a lot too. But basically what it does is we don't have to drill on the teeth at all. We just place this material in between the teeth and we let it sit there. The kids are always watching TV back in their rooms or something like that and bored. But we place it there for about 2 minutes. We reapply it for like another couple minutes, and then it usually will remineralize the enamel and the dentin without having to put a filling in the tooth. A lot of parents are like, why don't we do that for all the fillings? Well, we can only do it for certain fillings if they're small. So that's why it's important to catch these things when they're small so that we can help to remineralize the teeth at a very early stage. Once they progress into the dentin a little bit more, then usually we're having to put a bigger filling into the tooth. But saying that, if a child is 9 or 10 years old and they get a cavity in a baby tooth, I'm not a big advocate for putting filling in teeth or pulling out a tooth or whatever at that age. Usually the tooth will come out before we have any issues. So it kind of just depends on your child's age and what they need, and we have lots of different options. So if you have any questions about your kids or about cavities or decay or anything like that in their teeth, please give us a call, 248-652-0024.